My name's Robert Solaire from Skyview, and I want to talk to you about light boxes. Light boxes are used for seasonal affective disorder or some circadian disorders like delayed sleep phase disorder or just general depression. And these things work phenomenally. There was a study looking at depression specifically and showed that light boxes actually work significantly better than the antidepressant medications that these patients were using. So it's a great non-pharmacological means to rid depression. Another study of 85,000 people showed that the more light you get, the less likely you are to be depressed. And so these things all point to this idea that we just need a lot more light, and light boxes is a great way to do it. But the problem why these things aren't used everywhere is because they are not comfortable. They're too bright. Even when doctors prescribe them, they're hardly ever used. And it's because it's all based on old science that's just putting a lot of bright light, targeting the visual photoreceptors. But the reception system that's driving this whole mood and circadian rhythm standpoint is a different photoreception system. So when you pinpoint that photoreception system specifically using light, all the light levels could come down, making it way more comfortable and making it so that it's something that should really be everywhere. And so when you do it and provide that bright light during the daytime and minimizing it at night, the benefits you get is increased mood, increased productivity, increased alertness, and better sleep. I think that's something we should all be wanting to have in our daily lives.